This is the Dr. Haley Show podcast. I'm your show host, Dr. Michael Haley. Today's guest is Dr. Cori Stern, who has a busy practice in Queens, New York. She helps people recover from many issues, including hormone imbalances, parasites, autoimmune disorders, thyroid conditions, and many more, using nutrient-dense foods and whole food supplements for medicine. Dr. Cori Stern, thank you so much for being on the Dr. Haley Show.
Thank you so much for having me.
Yeah. You're in like Long Island area, correct?
I'm in Queens, New York. Yeah.
And we have a lot in common. You are a chiropractor. And I'm really curious because, I know why I became a chiropractor. I had some things that led up to it growing up. And I went to this guy and he kind of almost did like a Jesus thing, and I wanted to be like Jesus raising the dead. What's your story? Why'd you choose to become a chiropractor?
I have quite a story, actually. It started when I was a fetus. My parents were raised on what I call garbage food. And so were their parents. So I was born with what I call a garbage body. And when we talk about garbage food, we're talking about processed chemicals, things that I don't consider to be actual food. I call them processed products. So as a child, I was always sick. I always had throat infections, ear infections, bladder infections. I was always on antibiotics. I thought this was normal. I thought all kids took this pink bubblegum tasting liquid medicine. And by the time I was 15, I had a throat infection that would not respond to any interventions. So I was getting put on one antibiotic after another. And I was quite sick. It was the summertime and I was too sick to go out and hang out with my friends. And I got angry. And I decided that medical doctors don't seem to know how to fix things. And I decided I was going to fix myself. So I started to do some research. This is back in the days when there was no such thing as the internet. So I'm 60. So I was, this was mid 70s. And I was reading incessantly, and I stumbled on a magazine called Prevention, which was alternative health magazine. And I discovered something that astonished me, and that is there was a connection between what you eat and your health. And once I understood that, I understood why I was sick and could not recover. So I decided to completely change my own diet at 15. At the time, I was living in Manhattan in a high-rise building, and I was the building babysitter. So I was making good money. It was $1 an hour, but back then that was good money. And I saved up all my money and bought my own food. And I totally cleaned up my diet. I stopped eating sugar and white flour, anything processed. I got chemicals out of my diet. And then I found a book called Back to Eden, which is kind of what I call an herbal Bible. It was written in the 1920s, and it had every single herb and its therapeutic application. And I started messing around with herbs and making my own concoctions. And long story short, I healed myself. So it kind of planted the seed in me that maybe one day I would be able to do this for other people. And fast forward to adulthood, I explored all my options. And at least in New York, chiropractors can practice nutrition. So I figured I could do multiple modalities in helping people to recover their health. And I was seeing a chiropractor at the time that I made the decision, so I was inspired by that as well.
Yeah,
and here we are.
We do have similar stories. I mean, I grew up on, Wheaties for breakfast with a layer of sugar on them and peanut butter and jelly or bologna, whichever one was the lunch of the day for my school lunch. And then, pizza or spaghetti at night. And, I thought that was real food. And I didn't figure out that I was nutrient deficient until probably nearly 30 years old. I thought I could just go to the gym and exercise what I ate into superhuman, muscle and strength and beauty. no, doesn't work that way. Garbage in, garbage out. And it took me a lot longer to figure that out. But it was, junk food growing up. And, the food back then wasn't as bad as it is now.
Right.
It was more nutritious and had less chemicals in it. The younger generation is really at a disadvantage now.
Yes, exactly. I don't know if you're familiar with the Pottenger cat study that Dr. Pottenger in the early 50s was trying to create an adrenal drug for humans that had adrenal disease, and he was surgically removing adrenal glands from cats to try to extract adrenal hormones from them. And he noted that some of the cats were recovering fine post-surgery and some of them were sick or dying. And he specifically noted the cats that were like farm cats that hunted and ate raw food, that ate birds and mice, were the ones that were recovering well, and the ones that were on processed foods, canned cat food and such, were the ones that were not recovering. And this fascinated him. So he decided to do a study where he took the sick cats and started feeding them, a real food diet. And he then took the healthy cats and started feeding them processed food. And he noted over 3 generations, all of the changes, the diseases, the things that we see in our population now. The cats, the processed food cats started developing diabetes and heart disease and arthritis and osteoporosis and infertility and even mental illness. And it took 6 generations to reverse the damage, feeding the sick cats a healthy diet. So that is what we're seeing in our population now. And you're right, because the food is becoming progressively more toxic as time goes by.
And less nutritious at the same time.
Yeah. Yep.
It's funny because growing up, every so often I would have my course of antibiotics, against bio life, not realizing the damage I was doing to myself. And I think they're prescribed a whole lot less, yet there's a lot more antibiotics in the diet now than ever before, whether it's the animal foods where the animals are filled with antibiotics, or the chemicals, the glyphosate, the preservatives in the food are antibiotics. They're there to kill, microbiology in the food. It's an antibiotic, and they're consuming so much, annihilating their defenses, their immune system, their gut health without even realizing it.
Yes. So, and people that live near commercial farms, what's called confined feeding operation farms, the antibiotics that they inject the animals with is in the ground soil. So you can actually see, there are studies that show that people living, out in rural areas near these farms are even sicker. Their immune systems are completely under attack. And yes, on the glyphosate also, people, I don't understand how people are still using this weed killer Roundup when there's so much conclusive evidence that not only does it kill your gut biome, but it actually causes cancer. I have my own health show, and I interviewed the world's leading expert on glyphosate, Dr. Stephanie Seneff, brilliant woman. And it was just devastating because this chemical doesn't break down. It stays like generation after, even if a country bans it and they stop using it, it's still affecting people.
Yeah. And I can't stand when I'm, in the neighborhood and I see the people spraying their, around their house. It's like, what are you doing?
Yep. That's so funny because I was walking my dog one day and a guy was, so I'm in a big city, so there really aren't that many lawns and things like that, but he was spraying it around a city tree on a sidewalk. And I said, "You're poisoning the neighborhood." And he said, "What? I'm just killing weeds." And I said, you're doing a lot more. You're killing a lot more than just the weeds. Leave the poor weeds alone.
Yeah, and then the sneaky city people driving their trucks with the bug sprayers and 2 or 3 in the morning, annihilating not only bugs, it's antibiotics. It's there to kill life, and the bees are dying, and it is absolutely nuts what we're doing to the environment and to our bodies, because it's in the environment. Our bodies are in the environment, which brings me to a question for you, because over the years, I kind of went from the chiropractor towards the gut health person. I still do chiropractic. I love to adjust people, but I am seeing gut problems like never before. Are you finding the same?
Yeah, I would. So I mostly do nutrition. The same as you. I still do some chiropractic, but I find that chiropractic is more effective when people are not nutritionally deficient, and when their body systems are working. So I usually need to address nutritional issues first. And I would say that gut issues are probably on top of the list of complaints that people come in to see me for. Yes, absolutely.
Yeah, yeah. Now, just for the people that have the short attention span, you are seeing patients physically as well as they can make virtual appointments. Is that correct?
Yes, it is correct.
Okay. And where would they schedule? They would go to your website. I remember seeing the name. I think it's your name, drcoristern.com.
It's drcori.com. I couldn't get a website with the name Stern. So it's drcori.com. And then you just click on schedule a virtual consult.
Okay, great. And I saw you on a podcast talking about parasite cleanses. Now, this is an area that I've kind of avoided. I would like to help people have the right kinds of foods and create a good, healthy environment for the microbiome. But when it comes to doing the parasite cleanses, I've always been afraid of maybe damaging the microbiome and going in aggressively. And I always say, find someone that knows what they're doing in this area. It sounds like you've coached a lot of people through doing the parasite cleanse as well. Is that correct?
Yes, when I think it's appropriate and necessary. So first of all, you use the word aggressive, and I never ever do it aggressively. I do it gently. So, and I apply that principle to everything I do. If I find that somebody needs to detox chemicals or heavy metals, I go in gently. We start off on a gentle gradient and then increase it if needed. But the key to not doing damage, to not making the person feel worse, is what we call drainage. So when you're killing off pathogens in the body, no matter what they are, whether they're parasites or bacteria, fungus, yeast, viruses, anything, when the pathogens die, they release gunk. They release stuff that they have inside them. And parasites especially like to eat, they'll eat heavy metal. So in a way, if you're heavy metal toxic, parasites can be helpful in a sense, as long as they're not causing symptoms. But we don't want them to overtake your body. So it's always better to assist the body with detoxing heavy metals and then help to get rid of the parasites. But when they die, they'll release whatever it is, pus, just yucky stuff. So when that happens, if there's a lot of pathogens dying off, the person's body can have what we call a die-off reaction. And that's just a lot of gunk being released into their system. And if their body is not able to drain the gunk out properly, they will not feel well. And that's one of the reasons I don't do anything aggressively. Always make sure that your drainage organs are working and that you're providing the body assistance with drainage. So the drainage organs are the liver, the spleen, the kidneys, and the bowels. So for example, if somebody's constipated, you're not going to want to just start them on a parasite cleanse. You got to make sure they're pooping first, things like that.
Good point.
So that is the way to ensure that it goes smoothly and you're not going to do more harm with a cleanse like that.
Yeah, when you were talking about the die-off and the gunk they release, I think of pertussis, where someone gets pertussis and they have the infection and they're not coughing yet. You kind of know that they have it because someone around them that we figure out had it, because now they're coughing, has it, and you kind of see some symptoms developing. You probably have pertussis. And then they take the antibiotic or they beat it naturally or whatever the case is. And as they die off and release all those toxins, that's what's causing the cough. And it takes them anywhere from a month to 6 months to clear those toxins out. So they're continuing to cough for that whole time. The infection is long dead, but the release of the toxins when they die, that, hangs around.
Right. Causing lots of mucus. Yeah.
So I've never really thought about, okay, I have a big parasite infection. I want to go in and annihilate it. It would be the first, let's get rid of them. It makes sense. Let's slow down a little bit and do it right. I like that.
So preparing the body for any kind of cleanse, whether it's parasite cleanse or the same principle applies to a detox. You're going to get rid of the toxins through those drainage organs. So the drainage organs have to be functioning, and not everybody's are, and they can literally get gunked up themselves. So if a lot of stuff is moving through your drainage organs, it can get backed up, literally. Like it's almost like you can be constipated in your liver or your spleen or your kidneys. So there are ways of cleaning that stuff out first and opening up the channels so that things can exit the body.
I like that. That sounds wise. Who needs a parasite cleanse? How do you know whether or not someone has parasites?
That is a wonderful question. So the truth is everybody has parasites. Not everybody is symptomatic from the parasites, but there are many indicators that you might have them regarding the possible symptoms that you're experiencing. So one of the most common symptoms that people come in complaining about is itching in the rectal area. Very often that's pinworms. I don't really care what kind of parasite it is affecting a body because, you use the same principles no matter what.
I didn't have an itch there until you said it, but now that I'm thinking about it.
Go ahead and scratch. We'll wait.
No. Really, I'm actually just fine. But you know how that is. And there's probably people out there hearing you say that and saying, oh, that makes sense. Maybe I should, do something about this.
It's pretty common. And, if you have pets, you're more likely to have exposure. Even though a lot of people will say to me, oh, my pet, they did a parasite medication, and that doesn't mean the parasites are gone. So like antibiotics, all these drugs that kill off pathogens, they kill off the weak guys, but the strong ones survive and then they start reproducing. So there are many different symptoms of the possibility of having parasites because they don't only live in the gut. Parasites are pretty clever. They can hide. They can live anywhere. They can live in any organ. For example, liver flukes tend to live in the liver. And by the way, you can get those from swimming in a lake. There's many different sources of exposure. Eating raw fish or any raw protein, animal protein. if you garden a lot, they're in the soil. So even vegetables can have parasites on them. Now, this is not to scare people, just to say it's kind of a normal part of life. You'll have exposure. And if your immune system is working well, they're not necessarily going to cause a problem. It's just when they start to overgrow. So if they're in your gut, you may have gut symptoms, and that can be anything. It could be diarrhea, it can be, or just loose stool, it can be gas. I've seen everything. So, one of the things we say is parasites can cause any symptom. And I've had the most strange symptoms reported, people feeling vibrations in their pelvis, in their chest, people feeling like their skin is crawling, itching all over. So those are all things that might be indicators. And you start with opening up the drainage organs, making sure they're nice and clean, and then you start a gentle, very low dose of a parasite support supplement.
Yeah, and I think pretty much everyone listening is guilty of, all of the above, from, gardening to, eating possibly sushi or whatever the case is. So it does make sense that we'd all have parasites at some level, and that some people, their bodies are just managing it better than others.
Correct. Yep.
If I had only one tool to improve most people's health, if I could make only one recommendation for everyone, it would be to eat 10 servings of fruits and vegetables every day, representing all the colors. For those that just can't do that, I recommend a scoop of Green's powdered fruits and vegetables. Sure, you can buy powdered fruits and vegetables in capsules, but you would need to swallow about 40 capsules of a high-quality product to get the antioxidant power of 10 servings. Or you can add about a cup of water to a scoop of greens and drink it down as a tasty beverage. To get started today, head over to HaleyNutrition.com and put some Greens in the cart. Use the coupon code ANTIOXIDANTS before February 15th, 2024 to get 15% off your Greens vegetable and fruit powder. The coupon also works for the Haley Pro Vegan Protein Powder. Use a scoop of each in your favorite beverage as a perfect meal replacement. Now, back to the show. What else do you typically see in your office?
Oh, there's a lot. So I see a lot of thyroid issues. That's pretty much epidemic. Unfortunately, I'm seeing a lot of new cancer cases right now. A lot, almost weekly. I have at least one new patient with a diagnosis of cancer. See a lot of anxiety. I see so many people with sleep issues, poor sleep, interrupted sleep, trouble sleeping, insomnia. And then, of course, a lot of women with hormonal imbalances at all ages, young women with something called polycystic ovarian syndrome, where they have stopped menstruating, they have acne, they gain weight and can't lose it. Then, women who want to get pregnant and are having difficulty, women entering perimenopause that are very symptomatic with things like hot flashes. I had a new patient yesterday with no energy, hot flashes, depression. She was 47, just absolutely miserable. So those are probably the most common things I'm seeing on a daily basis, and also people whose immune system is compromised and they get sick a lot. Yeah. Sick with, colds and flu symptoms and things like that.
Yeah, I'm seeing a lot of the same stuff, and the thyroid especially. It's like, what happened in the past, couple decades that thyroid issues are so on the rise now?
I have an answer to that.
Please do.
Yeah. So it really started, I think what set it off was at some point in the 80s, at least in the United States, commercial wheat flour they started adding something called bromide to it. So it's called bromated flour. It's a anti-caking agent, I think. And prior to that, they were adding iodine. And the thyroid actually needs iodine to create its thyroid hormone. So people were not necessarily having iodine deficiency.
Well, this is interesting because on the periodic table, those are like stacked above, one and below each other. So they would have similar.
Exactly. So that's exactly where I was going with this. So for people that are iodine deficient, and where do you get iodine? You can get it in good quality salt, which I didn't mean to like specifically have this sitting here, but this is my pink salt. You can get it in seafood like seaweed and shellfish. So for people not eating that stuff, there's commercial iodized salt. So what I call processed salt that you buy in a supermarket that has iodine added, that's not really good for you. I actually have a whole video on what happens when you don't eat good salt. So when your thyroid is iodine deficient and you're feeding it something like bromide, which is very close to iodide molecularly, the thyroid will just take in whatever looks like iodine. And anything that ends in IDE or INE on the periodic table can be mistaken by the thyroid by an iodine deficient thyroid. So chlorine, right, which white flour also has. That's how it's made white. It's made with chlorine gas. People that clean with bleach, which is chlorine, people that swim in chlorinated swimming pools. There's a lot of it's in the water. It's in most water supplies. So
fluoride in the toothpaste.
Fluoride in the toothpaste. People get fluoride treatments at the dentist.
Interesting.
So yeah, so that was part of the issue, is that all of these ides were actually causing the thyroid to become toxic, and so it would start accelerating cellular death. So every organ, every part of your body experiences cellular death. I mean, that's a normal part of living. Your cells are always dying, and you're growing new ones. But when an organ becomes toxic, there's accelerated cellular death, and then it starts to not work as well. And when the immune system catches wind that there's too much dead stuff going on, dead tissue, it will try really hard. Part of the immune system's job is to clean up dead cells, and it will try really hard to keep up with it. And after a while, it could possibly start misfiring and attacking the healthy tissue. And that's what we call autoimmune disease. So in the case of the thyroid, Hashimoto's thyroiditis can be a consequence of a toxic thyroid. And the other thing that's happening now to make it all worse is that the thyroid is very sensitive to radiation. And a lot of people are doing this. And the electromagnetic field from the phone is radiation. So people are irradiating their thyroid on a regular basis in addition to poisoning it. So that's, most of the reasons why we're seeing this epidemic of thyroid issues.
So with all these hormonal issues, and I'm going through menopause right now.
Sorry.
But I'm in late 50s, and things change, and we start putting on weight, and luckily for me, I don't feel sluggish, and I'm not having too many issues sleeping and stuff like that. But people are really affected, some more than others, by these changes, whether it's a thyroid insufficiency, hyperthyroid, or the male or female hormones. What do we need to do? Do we need to get hormone replacement therapy?
I'm not a fan of that. When you take hormones into your body from the outside, you're going to be sending a signal to the glands that are supposed to be producing the hormones that they don't need to do that because there's enough in there, and they will become atrophied and they will stop working after a while, and then you'll be stuck on those hormones forever. And they're not necessarily good for you. They're drugs. Even bioidentical hormones are drugs. So the better approach is to feed the glands the replacement parts they need to start growing healthier tissue so that they actually work. And that's exactly what I do.
I'm kind of smiling because when I asked the question, you answered very gently, but your eyes screamed, no, to the hormones.
Yes, that I know I did that because I'm faced with this question every day, and people come in to see me for help all the time asking if they should go on hormone replacement therapy or actually already on it. One of the hormone replacement therapies is actually the drug that they put people with hypothyroidism on, which is called Synthroid, which is synthetic thyroid hormone. And, I have to say, I almost never fail to repair a thyroid. And I'm able to get people to wean off their synthetic thyroid hormone. So it's really not that difficult. Part of it is, a big part of it is always going to be, no matter what the symptoms are, no matter what the organs that are dysfunctional are, it's part of it is going to be eating a clean, nutrient-dense diet that's giving your body everything it needs to be able to not only repair damage, but to make sure things stay in working order. And most people, especially in the US, but I actually have virtual patients from all over the world, most people have nutritional deficiencies and imbalances because it's not that easy to access clean, nutrient-dense foods. So even if you are able to start improving your diet, and I can give you a link where people in the US can find a source of clean, nutrient-dense food anywhere in the US, and I even have a link for the rest of the world.
And for anyone listening right now, those links, I want them from you. If you're on the drhaley.com blog and looking at this podcast page, they will be down at the bottom.
And I also have them on my website under, I think it's called resources. So even if you start eating a clean, nutrient-dense diet, and by clean, we mean organic, we mean not sprayed with terrible chemicals like the glyphosate we were referencing earlier, or pesticides, all of that. Nutrient dense means they're grown in soil that actually has its nutrients replenished, which commercial farms don't do. Commercial farms use artificial fertilizer made out of petroleum. So organic farms use natural fertilizer, things poop. Like manure, right, poop, which is what we actually need to replenish the soil and put all the minerals back in. But so even if you're eating clean, nutrient-dense food, you still probably need some kind of supplementation and things specifically to get your organs to work. So in my line of work, we have a saying, like heals like. If your thyroid gland is not working, you may need to eat some thyroid gland. If your adrenal glands are not working, you may need to eat some adrenal gland, and so on. And most people these days will not eat organ meat. So I think our bodies are designed to eat. If you're eating animal, they're designed to eat the whole animal. I know not everybody agrees with eating animal, but I have found that my healthiest patients are omnivores, meaning they eat mostly animal with some plant foods. And if you don't want to eat organ meat, if you don't want to eat thyroid or don't want to eat adrenal gland, well, we have supplements for that. We have desiccated adrenal gland supplements. We have desiccated thyroid gland supplements. And those supplements give your bodies the replacement parts they need to grow healthy new tissue. And that's really the easiest way to repair organs so they start working well. So in your case of your menopause, you know, we would want to give your male hormone producing glands some help, you know, we don't want to feed them. And then of course there are herbs that help to support hormone production. So one of my favorite herbs for both men and women is tribulus. Tribulus is an herb that helps to support testosterone production, and it helps to increase circulation. So
I'm going to click the link.
So if you want to put 2 and 2 together, it's helpful for things like erectile dysfunction. So it increases blood supply to genitals in both men and women. So it actually improves your experience of sex. And then it also helps with endurance exercise because it's increasing your circulation. So there are a lot of herbs like that I use for hormone support for both men and women. I have a whole list of them, in addition to feeding the body good quality replacement parts.
You've explained it well. I'm going to ask you to contrast it, though, with the alternative, meaning you used words like nutrient-dense foods, and I've heard you in the past use the term whole food supplements. Other people might be buying bottles of pills, vitamins. Can you explain the difference between the whole food supplement and just help people really see the difference so they know if they're doing the right thing or not?
Yes, definitely. And actually I have a video dedicated to that topic on my show. So I want to use vitamin C as an example, because most people are taking, if you're taking vitamin C and you go grab your bottle of vitamin C right now and read the label, what you're actually taking is ascorbic acid. And on your label, it might say something like vitamin C as calcium ascorbate, or vitamin C as something with the word ascorbic or ascorbate in it. So vitamin C, like all vitamins, are a complex. There are many different components to vitamins, and vitamin C has things called J factors and P factors, and it has an enzyme in it called tyrosinase. It has all these cool things in it. And then it has an outer shell of ascorbic acid, and that is specifically to preserve the vitamin. Ascorbic acid is like a preservative. But for whatever reason, the people in charge of vitamins, FDA perhaps, don't recognize vitamin C as a complex. So they isolate, but vitamin C manufacturers isolate the ascorbic acid component of the vitamin C and call it vitamin C. So if you're taking 1,000 milligrams of what you think is vitamin C, you are taking 1,000 milligrams of ascorbic acid. Now the problem is that you're creating an imbalance in your body, because if you have too much ascorbic acid and not enough of the other guys, the P factors, the J factors, the tyrosinase, all the other things, first of all, you'll have a deficiency of those things. So you're actually vitamin C deficient, and the ascorbic acid will compete for uptake into your cells with the other things, and the ascorbic acid will win because there's more of it. So you literally are creating a deficiency in your body. And that is true of all synthetic vitamins. They're all isolates. They're all just isolated components of a complex. And vitamin D3 is an example. Vitamin D is also, there's D1, D2, D3, like it's a multifaceted molecule. And most vitamin D that people are taking is D3, which is the active form of D. That's when you have the whole component in your body, the whole vitamin, the sun will activate the D, and your body will be able to make it into D3. So when you're taking too much of just the 3 and not the other parts of it, you're creating an artificial imbalance in the body.
So your fortified milk might not be so fortified.
Correct. Exactly. And when it comes to milk, I strongly recommend that you just drink it straight out of the cow without it going through the pasteurization process. And I'm here to tell you that you won't die from that, because that's the only kind of dairy I ever ingest is raw, which
right.
The website that you're going to provide also gives you sources of raw, really good quality, clean, raw dairy, grass-fed. So yes, so the vitamins A and D that are provided, and especially when the milk is not only pasteurized, but it's skimmed or low fat, it's not food.
That's okay. You guys can have the skim milk. Give me all the cream. I might even chill it and enjoy it as, a nice ice cream.
It's so good for you. And raw cream and raw butter is loaded with a vitamin called F that most people don't even know about and are deficient in. And vitamin F interacts with vitamin D in your body, and it helps prevent skin cancer. So I do have my patients, getting onto either raw butter or vitamin F. And the supplements that I use are all made out of food. So you get my vitamin C has all the components of vitamin C in it. So it's made out of food sources that contain the whole complex.
Now, as we're having this discussion here and we're talking about some animal foods in the process, a lot of my customers, subscribers, have cancers or had cancers at one time. And they chose a very cleansing, detoxifying diet, more vegan than anything else, probably avoiding growth foods like animal foods. I do want to make the distinction that diets have different purposes, and an anti-cancer or cleansing type diet doesn't necessarily equate to survival of the fittest or the healthiest diet option. It might be the healthiest option for a season to get through what you're going through. But as we're talking about animal foods, there are a lot of benefits, and people are missing out on those benefits when they are strict raw vegans. So,
yes, and I will add that different bodies respond differently to different diets and different ratios of protein, fat, and carbohydrates. So I never do a one size fits all, except for the one consistent factor that I always recommend is that it's clean, meaning that it's not sprayed with pesticides. And that's especially important for cancer patients because you don't want to put more toxins in your body. So yes, so I mentioned I do have many cancer patients, and we have different recommendations based on the person's condition and presentation.
Yeah. I like Jordan Rubin's take on it. I once heard him say that, he'd look at food a few different ways. For him, it was important that it was a biblical food, but also a traditional food. Well, what does that mean? Well, cows could be biblical, but traditionally they were in the pastures eating grass.
Right,
And then
exactly.
The third component would be the science. Scientifically, we can say, well, that makes sense that the grass fed is better because we see it higher in omega-3s, and so it's less inflammatory, more even anti-cancer than the inflammatory CAFO fed, confined animal feed operation fed beef. So I like looking at those different perspectives. It's a great take on it. What is your favorite testimonial related to what you do?
Oh, wow. I have so many, and I have like 90 or so Google reviews that I love and read over and over again because it's so rewarding to hear improvements that people have had. But if I have to pick a favorite, I had a 12-year-old boy who was getting sick very frequently, and his mom was a patient, and I started to see the young man, and we had to clean up his diet. He was on an almost all sugar diet, and we got the diet cleaned up, and he was doing much better. And I don't know, maybe a few months into working with him, he came in sick, and he hadn't been sick in quite a while. And he came in with a buddy of his, another 12-year-old boy, who was sitting and watching and listening. So I asked my patient, let me ask you something. Did you eat sugar? Mm-hmm. And before he could answer me, the buddy said, he did. And I said, oh, okay. Thanks for letting me know. Did you know that sugar is bad for him and for you? And he said, yeah, he told me everything that you taught him. And you know what? I stopped eating sugar myself. And I used to be on medication for attention deficit, and I don't need it anymore. So this was not a patient of mine. And I actually got a kid off of a toxic drug without ever even meeting him. I get goosebumps every time I tell that story, because you just never know how widespread your effect is going to be and how you're going to save lives without ever knowing that you've done it.
Yeah, this might bleed into my next question then. What gets in the way of people getting well?
So from what I see, people, there's a lot of people that are addicted to sugar. Sugar is more addictive than cocaine. So you can never just tell somebody to stop eating sugar if they're addicted to it. You have to gently wean them off the same way you approach killing off parasites gently or detoxing gently. You wean people off sugar gently. People become very attached to their food. They become resistant to making changes. So if you try to do too much all at once, they won't be able to do it. They will fail and they will quit. They won't stick with it. I had a quick funny story. I had a new 35-year-old patient with a current diagnosis of diabetes and very severe, very, very high blood sugar. And he's a sugar addict, terrible diet, junk food diet, a single guy, doesn't cook. And I got him started on some supplements to help with blood sugar while we're working on cleaning up his diet, which we do gently week by week. And one of the supplements I gave him was an herb called gymnema. And gymnema helps to restore the cells in the pancreas that produce insulin. But the other thing that it can do is if you suck on it, it's a bitter herb. It makes sugar taste bad. I mentioned that to him just as an aside, if you want to try it. He came back a week later and he said, how dare you give me supplements that make Snapple taste bad? I can't drink Snapple anymore. And I'm like, I love it. I mean, he was joking, but that was an easy way to get him off the Snapple. That's not usually that simple.
Now, it's funny, as you're saying that, I'm thinking of the seed in the moringa tree. If you open those things up and you suck on that, anything you have after that actually tastes like sugar.
Oh, that's funny. Okay, so
that would be the other way to deal with it without taking sugar.
Right, but we want to alter people's taste buds, or actually restore their taste buds, so that sugar ends up not tasting well. Because in nature, I don't think God intended for us to eat a high sugar diet, because in nature, sugar is not that easily accessed. You have to fight bees to get honey. You have to get inside the bark of a tree to get maple syrup. It's not readily available or abundant in nature. So when people eat a lot of processed foods, chemicals, synthetic salt, sugars, their taste buds change, and only those foods taste good. And
Even
once you
meats that have been cured in sugars. I mean, it's
right,
everywhere.
right, and chemicals, right. And once you start weaning people off of these chemical processed products, their normal taste buds are restored, and suddenly that stuff doesn't taste good anymore. You can start tasting the chemicals in it. You can taste the sugar taste. It tastes too sweet. And the thing that I love the most is when we've gotten people off of these chemicals. They're eating a clean diet. They're feeling better. And then one day, whatever it's their birthday, it's a holiday, it's whatever occasion, and they ate something that, they shouldn't have eaten. And the symptom that they were suffering from comes back. So they came in with migraines. They haven't had a migraine in a few months, and now they've eaten something, and they get a migraine, and they're like, okay, I really don't want to have this experience anymore. I'm not going to do that again. I like when that happens. Yeah.
They fell off the wagon. What's the most important lifestyle change someone could make today to change their health?
Well, I think the thing that we were just talking about is starting the process of, if you start reducing the amount of sugar and processed chemicals in your diet, and also take some whole food supplements to correct deficiencies, your cravings will go away. You will have more energy. You will sleep better. And so those are important factors in restoring health, because if you have more energy, you can exercise. If you can sleep better, you're getting more rest, and you do most of your healing in your sleep. So chemical processed product diets interfere with all your body functions. And I have to pick that as the first step. You can even do things like you can meditate better when you don't have those chemicals in your body. You feel more at peace. Every single aspect of your life ends up being improved by cleaning up your diet and correcting your deficiencies.
What you said, that's probably had the biggest impact on me personally, meaning over the years, I've made connections. You said by cutting this out, you might sleep better. And when I started associating the changes in my life with the changes in my diet, for instance, I had a light bulb moment when, years ago, I haven't had a Diet Coke in a couple decades, but I was cutting off of it, realizing it was bad for me. And then one day I went back on it, just had a breakdown, had a Diet Coke. And this ringing in my ears came back. And that's when I realized that I hadn't had it for so long. And it was related to drinking, for me, Diet Coke. If I have a Diet Coke today, I have no doubt I'm going to get ringing in my ears again. I don't want that. So it now makes the Diet Coke like repulsive. I don't want anything to do with that. I used to eat processed meats, and I realized that I would have very violent dreams after eating processed meats. There's some kind of chemicals in there that are changing. It's interfering with my sleep. And, it would be very gross, disgusting, aggressive, violent dreams. Wow, I sleep better now by not eating those things. So when we start making those connections, then you no longer want the things that are interfering with your life. So I like how you put that.
Yeah, exactly what I'm talking about. And the ringing in your ears, I'm guessing, might be from the artificial sweetener in the Diet Coke. Yeah.
Probably. And, now I do like a little bit of sweet, but for the most part, I like I like things I like the meat and potatoes,
Me too. Me too.
And I would definitely prefer another helping of dinner over having dessert. That's
same
just
here.
me. I'm lucky.
Yeah, I crave real food now. Yeah.
But if I want something sweet, it's probably going to be something with, either dates or maybe stevia or something that's, not going to really feed that sugar high. So,
yep, good job. Very well done.
Is there, and I want to make sure that we let people know that you do have a lot of content there on YouTube, and there's places to learn a lot more. Well, let's go there a little bit too. What are they going to find on your YouTube channel?
I'm trying to hit every health topic imaginable. So it's a work in process because I add new videos as often as I can, but I have everything we talked about is on there. Everything. I have a thyroid video. I have an energy video. I have a back pain video. I have, whole food supplement, salt. I talk about very specific different herbs and what they can do for you. And I take requests. So if you want to hear about something that's not there yet, I'm happy to make a video about it. I'm very, very busy, so I'm not doing as the videos as often as I would like to, but I'm trying. I'm trying to make more space in my life to do more of them because I just love educating people, and the feedback I get, wow, I never understood that before. I never knew exactly what diabetes does to your body. I never understood the importance of my liver until I watched your video. So I love that. It makes me so happy to hear that.
Yeah. Oh, I put you in that position today where you had to answer the questions that I asked, sort of. Is there anything you wish that I had asked you?
That's a great question. The truth is, I was going to tell you after we were done, but since you're asking, this was a wonderful experience for me. I've gone on a lot of different people's shows, and you asked excellent questions, and everything that we talked about are areas of interest and expertise. And you actually yourself seemed truly interested in my answers. So no, I think we covered everything that I would have ever dreamed about wanting to talk about. Thank you.
That's great. And I can see a lot of your influences from, things like probably maybe Little Weston A. Price and maybe Natasha McBride. But so you're very knowledgeable, well studied. And when we talk about your YouTube channel, I know the content there, it might not be, from this week, but it's evergreen, meaning knowing where your knowledge comes from. It's like, okay, well, all I did is went back to what real food is. And that doesn't change. It's not going to change. So
Right. And when new things come out, I'll do an updated video on it. And by the way, you mentioned Weston A. Price. I have the president and founder of Weston A. Price Foundation. Twice I interviewed her. Amazing woman.
Oh, yeah. Neat.
Yeah.
That is exciting. Sally Fallon, maybe?
Yeah, Sally Fallon, who founded the Real Milk campaign. So everything I learned about raw milk, I learned from her, and I have a video. I interviewed her about it. And then we did another video on foods for fertility, but I didn't call it that because men weren't watching the video. So I called it something like fat and cholesterol good for you. It was very interesting about how different cultures, what they eat when they're planning to get pregnant, and the specific fats that they eat, like bear fat, Native Americans eating bear fat. Fascinating stuff.
Oh, wow, that is interesting. I had no idea. Well, it's been truly a pleasure. I want to thank you so much for being on the Dr. Haley Show podcast. I'm going to have to get a list of those important links. And for the people listening, go to the blog page, drhaley.com, to see this podcast, because I know there's going to be a list of links that won't fit right below the video. So, I can put everything on the blog page, and we'll link to your website, how to get in touch with Dr. Cori Stern. It's all going to be there. So thank you so much.
Thank you, Doctor.